Hello, my name is Nicole Norman, and I chose to do my first career profile, number one, on the job title Psychosocial Rehabilitation Specialist. The example organization that I got a lot of my information from was the Tri-City Mental Health Center in Pomona, California. And I did not have a career contact. I don't know anyone in this field at all. So I got most of my research from from 3 websites, and also from that mental health care center. The working environment are basically 2 different types. You either work in an elementary school or you can work in a mental health center. So if you're working in a mental health center, this could be a large hospital or it could be a small facility. You can also work as an independent contractor and work with children in elementary schools, as I said, or even work with individuals or families right out of their homes. This job can be family friendly. If working with adult patients, they can often be seen during the day. But if you're working with children, young children, they cannot be treated during elementary school hours. So for the younger children, you would need to be setting your appointments up with them in the afternoons or evenings. Sometimes it's possible that you may be asked to come to see a patient with no warning if there's a crisis situation. There are several typical stressors of the job. Some of the typical stressors would be a lot of paperwork. When you're dealing with the mentally ill, you often are being treated and paying for their treatment with Medi-Cal or Medicaid insurance. So when you're dealing with those insurance types, that comes with a lot of paperwork. So it's important, and it's also very important to try to stay patient and positive when you're working with these children and adults with special needs. This can often be a high stress level job. They get frustrated easily, and it can be difficult and add stress. So that can be a stressor. And if you can handle yourself and be patient and stay positive, it will help the situation and help your patient. I was very surprised with the benefits. There are none. I researched quite a bit. Couldn't find any companies that are hiring that will provide any health care, life insurance, retirement, or any benefits at all. So I was quite surprised by that. Okay, common job tasks. You would provide clinical case management, psychosocial rehabilitation services for adults with moderate to severe mental illness in the field-based community mental health setting. At times, you may be asked to do crisis interventions with patients that are really struggling to cope. In schools, the job task would be a little bit different. In schools, in elementary schools, your job task would consist of assisting students in gaining and utilizing skills necessary to participate successfully in school, such as behavior control, social skills, appropriate interpersonal behavior, symptom management, and coping skills, and also to help provide strategies in designing planned interventions for challenged students. The educational requirements that you need to work as a PSR specialist: you must have your bachelor's degree in a behavioral science, education, or medicine. A PSR specialist must have at least 21 semester credit hours in human service fields such as psychology, social work, special education, counseling, or psychosocial rehabilitation. The starting pay, the hourly rate starting is $14.44, and an experienced salary is $22.72. The next step up would be to go into like marriage and family counseling or a counseling situation where you would need your master's degree, and that would bump your pay up quite a bit, of course. And miscellaneous career information. This obviously, when you're working with these special individuals, your job can be very rewarding. So this job, as you see the patients progress, you can see the happiness in their faces and the big smile that's on their face, and you can really feel a difference as you're making a difference with these individuals and also bringing happiness and calmness to the family unit. So this would be a very rewarding job. I received my information from 3 different sources, 3 different websites, like I said, with the Tri-City Mental Health Center, we got a lot of information. And then also from Wikipedia.org and the Psychiatric Rehabilitation website. And then just our own BYU.edu, marriage and family studies.